Surgical options, I don't want to go into this. You can do whatever surgery you like, but there's something that I do want to bring to your attention, and that is the relevance of smart surgery. So all these surgical options, including ligation, cryodiathermy, harmonic and plasma knife surgeries, laser surgeries, conventional surgeries, all these kind of things, they all have recurrences. And there's nothing magic about any of them. There's no way in which you can remove a tumor by magic. When you talk to an owner that you're going to remove their sarcoid with a laser, you know what they see? They see Captain Kirk and Dr. McCoy and Spock and Star Trek. You know, that's what they see. They don't realize that it's just a bloodless scalpel. It doesn't give you any great advantage except reducing the amount of seeding that develops in the site. And that shouldn't happen anyway, of course, if you do it properly. So the constraints on tumor surgery, well, you can see that defining the margin of the tumor is the biggest thing of all. But of course, there are anatomic constraints. How deep can you go? How wide can you go? There's bleeding, there's cell seeding from operative open sarcoids within the area, which contaminate the wound site and then grow later on. So, you know, the objective here is to have two teams. I mean, I'm a great fan of this, that you have one cutting team who take the tumor off, and then the other guys are having tea, and then the cutting team packs up and goes and has tea, and the closing team comes in and closes the wound, so that the cutting team is not constrained by the thought, how am I going to close this? They don't bother with it. They leave it to somebody else to do it. It sounds a bit simplistic, but you know, it's a realistic challenge for sure. So post-surgical recurrence is a disaster, of course, whenever it happens, because it starts deep and works its way to the surface. And that means that by the time you see it, the tumor is inevitably enormous. So whenever you do surgery, you have to confirm your margin safety. Do not compromise on this, please, and do not economize. If you have to economize on anything, economize on the suture material, economize on the drugs, economize on anything whatsoever, but do not economize on the thing that protects you from the threat of subsequent litigation and aggravation. That is the pathology. Submit the samples. That is a rule, in my view, that is the proper professional thing to do. It protects the surgeon, it protects the horse, it protects the owner, and it is the right and proper professional thing to do. Don't ask the owner if they want it. It's nothing to do with the owner. They are not in any position to decide whether the histology should be performed or not. Smart surgery is the thing I wanted to just talk to you about, which is a little bit faster, a little bit better, and is a method of treatment which seems to work very well in reducing the amount of seeding and the amount of breakdown, etc. So this is done by identifying the tumor, preparing it for surgery, covering it up with an impermeable dressing, wrapping it with a cohesive bandage dressing. I beg your pardon, that's gone back one. Okay, let's just go back one. Okay, wrapping it up with this and then making a sterile dressing over the surface of it. And then once you've done that, you've included the tumor and a base area, which by lifting it up, and then you put clamps across the bottom below it. And then you put horizontal mattress sutures in a row below the clamps like this.